If any of my female patients tells me any one of these three symptoms, I'll be really worried for them. Number one, if they report postcoital bleeding. By that I mean if they come in and tell me that they have bleeding following intercourse, I'll be quite worried because there are a few things that can cause that. But the one that I'm mostly worried about is cervical cancer. And this is something that, if picked early, can be treated, and survival rate is close to 80% in 5 years, really. So cervical cancer will be one thing that I will be on the lookout for, even though there are a few other things that can cause it, like maybe if we're dealing with chlamydia, even in some cases of cervical ectropion. But cervical cancer will be on my topmost list. The second thing is if they come in, particularly for women who have gone through menopause, and they come in saying that long after they've been through menopause, they are now having what we call postmenopausal bleeding. I take a history from them. They've not recently started HRT. I'll be quite concerned, and I will want to rule out possible endometrial hyperplasia or any kind of malignancy, really. So that kind of patient is one that I would want to investigate thoroughly, do some pelvic examination, and also consider possibly doing a pelvic ultrasound, and lastly going for some sort of endometrial sampling, really, to rule out possible womb cancer. It's very common, and womb cancer is again one of the very cancers that can be treated if caught early enough with very good outcome, really. Thirdly, is if they come in talking about abdominal distension or bloating, particularly again in postmenopausal women. If they come in saying that they feel bloated, they are having abdominal distension, I will want to consider some investigations to rule out ovarian cancer. That is one cancer that can be easily missed because of the non-specific nature of the symptoms. So they can come in with very non-specific symptoms like bloating, and many times it can be missed. So we want to do some blood tests like CA125, do an ultrasound, and that kind of patient I would not want to sit on. I want to refer through to a gynecologist for further assessment. So if you know of any other symptoms that will give you any sort of concern about a patient, let me know in the comment section. If you're a patient and or you're a woman and you're experiencing any of these three symptoms that I've outlined, it's best to see your doctor as soon as possible. I'll see you in the next one. Bye.